Hello, everyone. Thank you for joining us today. Today, we're going to be presenting on preparing the health center workforce for the COVID-19 era. This is brought to you by the National Center for Health and Public Housing. So before we get started, these are just a few housekeeping items that we're going to go over. First, all participants are muted upon entry. If you have any questions or any comments, or if you have any promising practices that you would like to share with us regarding this topic, please make sure that you also engage in the chat. Raise your hand if you would like to unmute. And this meeting is also being recorded. The slides and recording link will be sent via email after today's session. And feel free to also provide a brief introduction of yourself via the chat with your name, your organization name, and title. And I'm going to pass it on to Dr. Jose Leon, who is going to go over the introductions of today's speakers.
Thank you, Fide, and thank you so much, everyone, for being with us today. This is a great topic, something that is a priority for HRSA and for the healthcare arena in general. So we are very happy to have all of you attending this webinar. If you have any questions, please feel free to ask your questions. We have great panelists for today's session, and we hope that this is going to be an interactive session. Again, this is a topic that is important for all of us. If you have any challenges that you would like to share with us, or any promising practices or any solutions to this topic, please feel free to either use the chat box, or we can also unmute your line. I am very pleased to have two great speakers for today's webinar. We are going to have Beatriz Fernandez and Zara Marcellian. Beatriz Fernandez is the Chief Human Resource Officer at La Maestra Community Health Centers, and she's been with La Maestra for 10 years and started as an HR assistant in 2013. She's been able to grow the HR department and currently focusing on talent management, retention, and motivation solutions. She received her master's degree last year in December 2022. And she enjoys working and helping the community and staff, and find it rewarding every day of her career. We also have Dr. Zara Marcellian. Dr. Zara Marcellian has been presenting for the National Center for Health and Public Housing on different topics. She is a very well-versed CEO, and Dr. Zara Marcellian is the founder, president, and CEO of La Maestra Family Clinic, an FQAC that serves approximately 45,000 individuals annually in San Diego County, California. Zara is an award-winning author and a well-regarded speaker and an international consultant. Zara also serves on numerous advisory boards, and for more than 36 years, Zara has developed programs and services that meet the community's needs. Zara developed a holistic solution-based model to address overall health and well-being for all patients, regardless of their ability to pay. The model, known as the La Maestra Circle of Care, provides primary and especially healthcare and social services to address the social determinants of health. Services include an on-site food pantry, housing, microcredit, and micro-enterprise programs, job training programs, after school and summer programs, outreach, health education, environmental health, case management, and public programs application assistance. Next slide, please. Just this is our disclaimer. The National Center for Health and Public Housing is supported by HRSA to provide training and technical assistance to health centers. We work very closely with those health centers located in or immediately accessible to public housing. Next slide, please. So for those who are not familiar with the PHPC program, in 2021, over 1,300 health centers provided services to 30 million patients. 458 of these 13 plus FQACs reported to be in or immediately accessible to public housing. And in 2021, they served 5.7 million patients. 108 of these health centers are public housing primary care. And or in the same year, they provided services to over 900,000 patients. Next slide, please. Just a quick reminder about the public housing demographics. In case you are not familiar with those living in public housing, there are around 1.5 million residents living in public housing. The average household size is about 2 people per household. 38% of these households report to have a person with at least one disability. 52% are white. 91% are considered low income. 43% are African American. 26% are Latinx. 19% of those living in public housing are over the age of 65. 36% of households report to have children under the age of 17, and 32% of the households are female-headed with children. Next slide, please. So these are our learning objectives. Zara and Beatriz are going to discuss challenges to recruit and retain staff in primary healthcare, identify effective strategies to retain a talented, qualified, and diverse workforce, and examine some strategies for filling the shortages. Next slide, please. Just a very brief introduction. This was discussed at the NAC PNI. For those who attended the PNI, this was information or data provided by Dr. Padilla. And there are some projected shortages through 2035. Primary care is going to be over 35,000. Behavioral health specialists, the projected shortage is going to be over 15,000. Oral health providers over 1,310. Maternal health over 5,000, almost 6,000. And licensed practical nurses are going to be over 140,000. Next slide, please. This is from another source, and remember that these are just numbers that are provided based on some studies, but according to this study, the expected number of primary care physicians will decrease in non-metro areas from 26,000 to almost 24,000 in 2030. And the largest shortages in the primary care physician workforce are projected to be in the states of Nevada, Mississippi, Oklahoma, and Arizona. And the largest surpluses are projected in the District of Columbia, Vermont, Maine, and Massachusetts. So this is important information because all health centers need to assess the needs, the workforce needs for the next few years, and based on the needs, they would need to develop some strategies to recruit and retain their workforce. Next slide, please. Again, HRSA is working on this particular issue, and this is based on HRSA priorities. This is the first priority, which is strengthen the health centers to address critical and emerging healthcare issues on the evolving healthcare environment. And the very first one on the list is support the health center workforce. Next slide, please. So without further ado, I will turn it over to Zara. Hello, Zara.
Hello, Jose. Thank you so much for this opportunity to present and to share some of La Maestra's experiences and some of our strategies to address retention or recruitment and retention, and basically address some of these challenges that we're presented with post-COVID. So next slide, please. I wanted to start off by sharing La Maestra's holistic circle of care that we have developed over, now 36 years, and share with you some of our services. And you can see the red petals represent all of the healthcare related or direct services. primary care, specialty clinics. We have additional healthcare services. We do behavioral health, mental health. We have the medication-assisted treatment program integrated with our medical services. Then you see more of the on-site specialty care. We have pharmacy labs. We have mobile clinics, licensed mobile clinics, chiropractor services, diabetes clinic, liver clinic, asthma clinic, and many others that have been created to respond to the needs of the communities and the populations that we serve. We are very culturally diverse. Our populations are, over, 55 languages and dialects. We're here in San Diego within the border region. And so, we try to include, first of all, always know who's in our population catchment areas and what their special needs are, what their backgrounds are, that then will, of course, enhance the medical challenges that they might have. And not just medical, dental, mental health, and the traditional, primary care comprehensive services, but also looking at the social determinants of health and integrating them with all of our care modalities. So you can see here some of the other petals have deal with, those social determinants. Housing, we have transitional housing. We work with the unhoused. We have homeless designated clinic. We're then in schools also. We have 3 school-based clinics. And we work with the different districts here, unified districts in San Diego County, with through our mobile licensed clinics as well. And then we get into the areas of education, helping people further their education through microcredit, through job training programs. And we are a super pantry. So our food pantry has been very busy during COVID. After COVID, it just seems like, there's the demand is incredible. Then we have like human trafficking assistance programs, immigration assistance. We have a preschool and a school that is for after the traditional hours of school. The kids come over and we do, help with their homework, and we provide them with other activities that they are not going to be exposed to at school. The areas of art, music, again, career development, providing them with a safe and nurturing support system. And again, working them into the circle of care with their families as well, and addressing mental health issues that for kids have been, huge during COVID and post-COVID, and opening those access pathways to them and to their families. So next slide, please. This gives you an idea of the annual number of La Maestra patients and visits. If you can see there, 2023 so far. This goes only through February, the bar on the right. We've been able to inch back up to our utilization numbers, pre-COVID, and hopefully this year we'll be able to see those numbers rise even more. We have 21 sites in 4 of our San Diego communities: City Heights, El Cajon, National City, Lemon Grove. Again, we have the mobile clinics that are licensed, and they go to numerous locations. We do a lot of partnership with our network of community-based organizations, ethnic-based organizations across our communities. We have more than 55 languages and dialects spoken by 850 some employees, and those employees are always from the populations that we serve. And that's been one of our driving areas of focus in terms of recruiting employees, and again, knowing who is in our population base, who are the subset of our populations, and then making sure to align the staff with those populations to promote cultural competency and sensitivity and inclusiveness, which we'll get to later on in the presentation. Next slide, please. Okay, so just one second, I had a pop up here. I wanted to share a recent study provided by the University of San Diego on nonprofits in general here in San Diego and what their hiring challenges are. So then we can, after that, share some of the trends that we've seen at La Maestra with our hiring processes. We can see that in nonprofits, the programs, direct services is 68%. In terms of, most difficult levels and positions to hire for. We see that 60% of the nonprofits predict they're going to have to hire for new positions in the coming year, and that's despite 83% giving, raises throughout their organizations, and still there's this real difficulty in retaining employees and recruiting employees that are going to fit in their organization. We see that the other areas here where they're finding difficulty is recruiting for, admin, operations, human resources, that's at 40%. Fundraising and development, that's certainly a challenge, 39%. And then you can see the other areas here as well. So next slide, please. The other important factor to consider is, the effect of inflation on, health centers and the ability to keep up with the demand for services that's predicted to keep increasing. And the costs are so much higher and they continue to rise because of inflation. And our employees are worried, how are they going to make ends meet? And they're always looking then to the employer to keep increasing their rates, their wages, so that they can, provide for their families. And they're really concerned. Employees are concerned about inflation. In San Diego, housing is a particular concern for our employees. The rent is, astronomical. It continues to increase. There's not enough housing, despite the county's efforts to, build more housing, affordable housing. It doesn't seem to ever meet the need. So that's another big factor here in San Diego for our employees. Next slide, please. So at La Maestra, now we're going to be talking about recruitment and retention challenges. Again, we've talked about, the lack of sufficient primary care providers. Jose shared some of the projections from NAC. And we see that here in San Diego, of course. And aside from, the lack of providers, then we at La Maestra, because we're so culturally diverse, we always try to screen and do like an organizational fit for providers, for staff, and really see if those providers have a passion to serve our populations that access services at La Maestra. Is that what they are feeling comfortable with? Or, from that pool of providers that you're interviewing, maybe what they really want is to be in the for-profit world in other areas of the city, right? So it's really important when we're doing our screening, as Beatrice will describe, the screening, the orientation, to see and make sure that those applicants are really going to be a fit. So what this does is it decreases that supply pool of providers for places like health centers like La Maestra, who are doing that screening and organizational fit testing. We do have a lot of competition from the for-profit sector. specifically from other hospitals and like from Kaiser. They're always increasing the pay ranges, and we somehow always have to be, trying to figure out how to retain those providers and nurses that we see such a shortage for. So higher pay, we have the COVID burnout, the fatigue. Many providers and staff moved to other states during COVID, and we'll hear from Beatrice some of the trends that we've noticed. And then we're still dealing with a reluctance for these providers that were, remoting in to provide the visits. And now that the big push has been for them to come back in person into the clinic sites, we're seeing more reluctance on that. Of course, we will continue to use, telehealth, and specifically around, mental health. That seems to be very popular with our patients. They want to continue those kinds of services, but for primary care, we really need those providers to be back in person at the clinic site. So we've done a lot of work around that. Again, the nursing shortage, LVN shortage is there, and that's a challenge. And we will be touching on some of the strategies that we've adopted and partnerships to increase that pipeline into La Maestra. Next slide. So Beatrice, would you like to cover this slide?
Of course. So recruitment, now we work with a variety of different generations and backgrounds. So it's been really difficult right now. We work with millennials, baby boomers, Gen X, Gen Z. So it's been pretty difficult for recruitment and having people stay on board, only because, people now, it's all about social media and different trends. So a lot of trends have been coming about, with the millennials. They go on TikTok, they go on Facebook, and they see all these different trends like the Great Resignation, the quiet quitting. So a lot of it has been difficult, to keep the workforce, to stay, within a nonprofit organization. A lot of these people, like Dr. Marcelian was explaining, inflation has made it difficult to keep people who really want to work in the nonprofit and help the community out. They want to work for a for-profit, and it's really hard to compete with the hospitals who have higher pays, and are able to pay, insurances or whatnot. So it's been really difficult to keep millennials, I guess, in the nonprofit world.
Thank you. I also wanted to point out, I've read numerous articles about, different ages of our populations and the workforce, like Beatrice was describing, and the very high percentage of millennials, for example, really want to see that their work that they come to do every day is going to have some impact, positive impact on social change, social justice. So that's why one of the strategies that we have really worked on is to increase the orientation, the training, and basically explaining our background, what we've done to create, the Circle of Care for 36 years, what other areas we're engaged in, and how they will be able to be part of these strategies around social justice, well-being, with, in a job with La Maestra. So it's really kind of connecting that for applicants so that they can see that they will be part of this bigger effort. Thank you. Next slide. So just quickly, I wanted to mention some of the other challenges that we're facing here in California with our Senate bills. Right now, there's one California Senate Bill 525 that is proposing to raise the minimum wage for all healthcare staff to $25 an hour. And in the salaried positions, it's going to start at $104,000 per year. And that's going to apply to all healthcare organizations and private practices with 26 or more employees. Now, we would love to be able to pay everybody a lot more an hour. But if you're looking at the organizational budget and our reimbursements that do not increase, like our PPS rates do not increase based on inflation and, you know, the cost for services and the cost for pay and goods and so forth. So we have a fixed reimbursement that, yes, we supplement through grants and so forth, but it's not sustainable moving forward if we're going to have to be paying this minimum wage to all of our employees. And then what that would do for those employees, let's say that started with us 2-3 years ago, and they're getting $25 an hour now, and they see all of these new people coming in, or the entry-level positions being bumped up to $25 minimum, they also will say, well, wait a minute. So my pay range now needs to be bumped up. And so we're going to see this ripple effect upward all throughout the organization. So the cost isn't just, you know, bringing everybody up to this new minimum wage. It's going to push up all of the pay ranges throughout the organization. And that's a very concerning mandate that will happen at some point. And we suspect that, you know, maybe it's not going to go through now, but the unions are definitely pushing for this to happen. Another challenge is that the other Senate bill is trying to propose that all health centers in the state of California provide, you know, yearly reporting all in one location for public consumption about all of the revenues that the health centers have, the number of sites, our PPS rates, the gross revenue sources, pay rates, benefits, retention rates, patient type, visits by type, and all the managed care plans that we contract with, total operating expenses, mergers and acquisitions. They are proposing to have all of this information by health center. So anybody could look up and say, okay, they can get all of this information. Again, most health centers do provide this information already, you know, through our 990s that we're required to submit, our UDS reports, our OSHPD, which is the state reporting, you know, the annual reporting on the productivity, kinds of visits and so forth. And recently California has already adopted the Transparency Act. So all of us are posting pay ranges for each position right now anyway. So I'm just mentioning this as additional challenges to, again, be able to recruit and retain employees. And it's a lot. Next slide. So see, this is some of the trends that Beatrice was referring to. I'll let you go ahead and take this slide, Beatrice.
So as I was mentioning earlier, there was 4 different trends in 2021 when we started coming back into the office and whatnot. After COVID, we got the Great Resignation. A lot of people were resigning for different reasons. Either the pay was too low, they felt that there was no opportunities for advancement, childcare issues. Those were the major ones. You know, actually for our organization, that really wasn't a big issue with us. It was, you know, we were able to help a lot of the employees who were able to work remotely, were able to be at home with their children while helping them do their homework. But, you know, a lot of them, you know, families stick together, and especially in our community and a lot of our employees, and a lot of people move to different states. It's kind of funny because we live in California, and, you know, we were, you know, doing some audits, and you know, we found a couple of people moved to Texas without letting us know. So, you know, we were doing some adjustments and whatnot, and we would have them come in and sign paperwork, and they were like, oh, well, it's because I'm living out in Texas. And we were like, whoa, that can't be happening. You know, so they had to resign, you know, because we couldn't, you know, keep up with the taxes, or, you know, in Texas and workers' comp and whatnot. And we had to, you know, start bringing people in the office. Another one of those was quiet quitting. In 2022, basically people decided that they just wanted to do the minimal performance, whatever was on their job description, nothing more, nothing less. So that kind of put a damper in, the employees' moods and trying to, keep up with everything that, we had missed during COVID and trying to keep up with the workforce. So that was kind of a little dampening with us because, people just wanted to do the bare minimum, nothing more. 2022 into 2023, we have the career cushioning, which is basically employees have a plan B. A lot of employees, what they do, they end up applying to different places to see if they can get more money or who would offer them more, or even starting like a home business to see, maybe that they can just make more off their home business and quitting their job because of different circumstances. Another one is quiet hiring. A lot of people say that this is a negative one, but I see it as a positive one, because quiet hiring is basically you have your employees and the managers are tasking them with more, with additional tasks and roles and whatnot. But this is actually a time where they can show that they can shine and that they can go ahead and do, more, where they can be promoted to different positions such as managers and directors. So there was a lot of controversy going back and forth. People were saying, well, the manager shouldn't be giving them so much work, on top of the regular duties. But no, this actually helped them to where they can show that they can do more than what they're, being asked, and, get promoted to, like I said, managers or directors, and help them within their career. Next. Do you have anything to add, Dr. Zara?
No, just that, that is the opportunity during these times of crisis and change and upheaval, where you see the star performers that really are wanting to, advance in their work and be promoted. And they definitely are rising, and we've seen that. Thank you. So this slide is talking about, current employee stresses that, we as employers need to really pay attention to. A lot of the employees still are reporting work-related stress post-COVID. Just because COVID has finished, it seems like, doesn't mean that, everything can go back the way it was pre-COVID. People are finding themselves in different situations. They still are dealing with issues of housing, maybe still being really, delayed on their rent. Also, they've had to move different times. And again, Americans are anxious about inflation and always looking at, are we going to have enough money at the end of the 2 weeks to meet our needs for our families? So this is another link for you to follow. Next slide, please. These next slides have to do with, again, the post-COVID employee well-being as it relates to retention strategies and what suggestions we could have to implement, different programs around the mental, physical, and financial status of employees. And these are some suggestions for the mental well-being, is to, during COVID, we saw this especially, is really encouraging an acceptance about mental health, and that COVID did put a lot of stress on families and employees, and what we could do as an organization to open the access to pathways for employees to obtain those mental health services around coping skills, just to have somebody to talk to and share some of their anxiety before it gets to be major depression about the uncertainty of life in general. And, what's going to happen now post-COVID? Are they going to continue their plans in terms of, pursuing more of a career in healthcare, let's say, continuing it? Or, is this a time in their life where they just want to jump into another sector? So that's something to really pay attention to. What we've done is we have leveraged the mental health resources to assist our employees. And we have, instituted during COVID, and it continues today, to have free mental health counseling visits for our employees with our providers. And again, a lot of it's about, family issues, stresses. It's going to be about anxiety, depression, coping skills, and feeling kind of isolated. So that's something that we've been able to offer our employees. Also encourage work-life balance through yoga, meditation. We've had Zumba, now that everybody's back in person, during the breaks, after work, before work, having walking groups so people could, walk together and talk and, share about their life post-COVID and what their plans are. And again, they feel that supportive network. So that's important. So these are some of the examples that we have offered. And of course, we have people on our staff and through collaborations with partners to deal with rental assistance programs or rental deferrals for housing. We continue to offer hot meals and lunches that we started during COVID, and we continue that now to help support, the food and the nutrition for the families, childcare referrals, and a wonderful partnership with the YMCA for our staff and their families so they can, be involved in the exercise programs, the classes that they have, and again, providing that, that network of support for our employees and their families during this difficult time. Next slide. So we talked about, sponsoring physical well-being activities at work. And we have certain champions, in different departments that are willing to head these initiatives up, and then it gets built on with, encouraging healthy habits in our nutrition programs. Health educators are there. Also the weight management, exercise routines. So there's a lot of resources within the organization, and then through our partnerships with other organizations within the community that our employees can access resources from. Again, flexible work schedules. We know this is a continued issue, childcare, and taking care of older adults as well in the family. It adds a lot of stress. So we try our best at La Maestra, especially with a lot of our entry-level staff who are single moms, and really work with them to see what their needs are and how we can be flexible with the work schedules. And then the hybrid remote positions, they will continue post-COVID, not as much as during COVID, but we try to match that up with our employees' needs. Thank you. Next slide. Beatrice, do you want to take this one?
I can. So financial well-being, here at La Maestra, also we provide different resources. We have different banks and credit unions come in and they talk to our staff about just to do some financial planning, financial coaching, which the employees really, really like and they appreciate a lot. We also offer FinFit loans, which is a short-term emergency loans for our staff, just in case, they get stuck. Like Dr. Zara was explaining earlier, some of our staff, especially with the higher cost in our rent, a lot of staff don't know if in 2 weeks, they'll have enough. So we found different ways so that we can help them during, so that they can get back on track. Also, another good one is that we are able to cash out our sick and vacation hours that we accrued. That's if budget allows. We don't have PTO, we have them separate. So we have vacation and our sick time. So we cap at 240, and our sick time is 190. And as long as we leave 40 hours in there, we'll send an email out, to Dr. Zara. A lot of our employees sometimes have emergencies. They need to pay for certain things for school or whatnot. Something came up, and they're able to cash out, their sick time or vacation time, so that they can, pay whatever they need to pay. We also have our 401k employee benefits, our education. So they'll come out probably about twice a year, and we'll talk about 401k and planning to help them save up, for the future. We also do career counseling and different resources for certifications to advance their education, which has been really, really great. That's been really fun to launch off and starting off and talking to the different employees and one-on-one and see what they want to do to advance their career, their education. So that's been very helpful. Next
slide.
slide. So the
So that's
Sorry.
you.
recruitment and retention strategies. So La Maestra has developed a talent management program, which has been really great and fun, doing all this from the start. We start, like Dr. Marcellian stated earlier, we do our recruitment, our interviews, we make sure that it's a match within the community. A lot of our employees, come from different backgrounds, we're a very diverse organization. And we just started our training program in-house, which has been really great. And a lot of the employees really like that. We have training during the middle of the year just to catch them up. And if they have any questions, different things like that. We have also an in-house career center for retention and advancement, like we were explaining earlier. Dr. Marcellian, we connect with different universities, different trade schools, community colleges, so that we can start sending our staff, so that they can get different certifications in medical assistant, LVNs, general assistants. We have a robust employee benefits. So we have 3 different tiers. We have our regular employees, which is a very still good benefits. We have our physician, which we pay 100% of their health benefits and for their families. And then we have for all our mid-levels, we pay for their health benefits with the subsidy towards their family if they have any. And we've established our own training programs in-house. We've developed pilot programs with local colleges and universities. So welcome back. We do the J1 visa programs. What else do we do? The Nurse Corps Scholarship and Loan Repayment Program, which, a lot of our nurses and our providers are very excited about that. And then I think that's it. Anything else that I missed, Dr. Sarah?
No, I think you covered it great. I know that we'll have a future webinar where we'll concentrate specifically on what those partnerships consist of and how we were able to work it into our regular, flow in our clinics, and liability issues and so forth, insurance coverage to be able to have those students on site. And then the range of what those training programs cover, it's not just the medical or dental or mental health. It's also going to be, our other staff areas, whether it's IT, HR, working in even janitorial maintenance programs, so people can continue as they're working with us to take training through these colleges, continuing education, and then get certifications, which then bumps them up and promotes them within our organization, and we retain them as they are continuing to advance their career. And again, it's trying to retain good people that really want to work in the community in this kind of field, right? So next slide, please.
So like Dr. Zara mentioned earlier, we hire a lot of people from the community, and I feel that that's been really great for our patients. The skills-based hiring, just to find the right fit that align with our mission, rather than hiring a college student right out of school and whatnot, and not having the connection with the community. That's really helped us out a lot. Also skill-based approach. The employees are able to solve real life situations. So for example, a lot of the people that we hire, they know what the community is going through, and they know what they're feeling, or they know what the feeling is to have, somebody older in the household and needing medical attention, or, whatever the case is, whatever their situation is. So a lot of our employees are able to connect with the community and our patients. So I feel like that's really helped out a lot in being able to retain those employees as well. And again, we offer the opportunity to broaden their skill sets through La Maestra Career Pathways, which has been a really cool program, that we just started launching so that they're able to, again, get whatever career interest they have and while still being able to work and, maintain their family and still go to school. Environmental, social, and governance, being transparent. That's a huge thing right now that's going on. In the state of California, they just passed the Transparency Bill Pay Act. So basically, when we are recruiting, we have to put a pay scale of what we're starting to the ending pay. Which has been really nice because now we're able to see what other places are paying, and we're able to, be right up there with them to offer them a decent pay. Technical skills also are highly valued, but with the shift in talent, these human skills are highly sought after as communication, customer service, leadership, attention to detail, and collaboration. Anything you'd like to add, Dr. Sarah?
That's good. That's good. Now we wanted to touch on promoting employee inclusion and belonging, and to piggyback on what Beatrice has already described, the different efforts to recruit and retain employees, grow them basically from within the communities to ensure that there's that trust and that bond that develops between the patients and the staff, right? Because the staff have been through a lot of the life experiences similar to the patients and the challenges. So whether we're talking about refugees, La Maestra is a resettlement agency for refugees as well. So the refugees, people from the reentry programs, working with the correctional facilities to provide those meetings and intake services while people are still in the correctional facilities before they come out, so they know where to go, and they already have that established relationship with providers of care. Or we're talking about people that are, other subsets of our populations that we want to include, and we want them to feel like they belong. So we have, for example, the unhoused and our homeless designated clinic and our, homeless navigators and outreach workers. And that feeds into a lot of the programs and services that we offer through our circle of care. And again, encouraging that feeling of belonging and being supported in a network that cares about people and who's in the community. And that's really a focus of ours. And so it's reflected in policies, procedures that are, around diversity in the workforce, and how equity is basically, available because of the accessibility, the accommodation, and the code of conduct that we have in our HR policies that we continuously review and provide trainings on and support for. And then, of course, the big question is, as everybody's approaching the diversity, equity, and inclusion policies and implementation is, do the behaviors of the organization and the employees really reflect the policies, or are the policies just there to have them? So we wanted to give an example of our employee wellness program. Beatrice, do you want to take that one?
Definitely. So our employee wellness program, we started this about maybe, I want to say 4 or 5 years ago. Again, we come from all different backgrounds and, different walks of life. And, sometimes our employees might run into some kind of trouble or whatnot, or they may fall back. So what we do, we'll test them or whatnot. We get together as a group. We actually have Robert Marquez, who's our director of the food pantry, but he also has, he's also part of our committee where we sit down, we'll place the employee on a 30-day leave. We'll send them to either our in-house rehab or an outside facility. They'll go through their treatment for 30 days. they'll come back, we'll review the file and whatnot, and then we continue testing them, and they continue their program, you know, until whenever they're ready. They continue with the family wellness services there at La Maestra as well. So we keep a good eye on them, and, you know, we follow up with them basically once a week. Robert Marquez does most of the following up daily, you know, where he'll meet with them. They'll go to meetings together and whatnot. But then, you know, they're still able to keep their job and get back in the workforce. You know, just because they made a mistake does not mean that, you know, gonna torture them for life or fire them. No, we're gonna be there to help them and, you know, hopefully get them back on track.
Yeah, that's a great example. And so you were mentioning Robert, and Robert is one of our many cultural liaisons. And we call, you know, our cultural liaisons are our staff that really have a calling and passion to represent and work with populations that have gone through the same challenges in life and experiences, traumatic experiences that they have. And so Robert's a great mentor. We have many others throughout the organization as well. He's a mentor and a sponsor for people in recovery. And so for those employees that are in recovery, we want to have that support for them and have it part of a formal program. So that was an example for that subset. And now we have more. Jose, do we have a couple more minutes?
Yes, we do. And we also have some questions for you, Zara
Okay.
and Beatriz. Do we have more slides to go over, or?
Yes, I just wanted to mention the other utilization of our cultural liaison program.
Okay.
Next slide. So this is, you know, we developed a medically trained cultural liaison program because we, as I mentioned in the beginning, we have, like, you know, so many languages, so many cultures that we work with, and we wanted to make sure that we're actually communicating and learning from those cultures, you know, what their beliefs are, what their traditions are, how to have them feel included and belong, and how do we hire from within those groups. So that really was dependent upon, you know, us working with the ethnic-based organizations, having different cultures represented on our board, on our leadership teams, on our focus groups, and really keeping a pulse on what the needs of these populations were and are. So this cultural liaison program then is, you know, specifically around not just the different cultures and the languages, but again, the life experiences and the backgrounds that people have, and how they could feel that trust relationship, that they are welcome, that they are embraced, not just welcome, but embraced. So this is, you know, about the refugees and immigrants. Another example is that, for example, in our human trafficking assistance program, La Maestra has a large group of transgender clients, and from that group, we assist through their immigration, through their life skills, through, you know, law enforcement, putting cases, helping them file cases, and again, through all of our circle of care services. They also have gotten together and helped us with training for our providers and employees on what it is to be sensitive and how to approach your, you know, patients that are transgender and have, you know, specific needs. So it's again knowing who you're serving and who you are including, and trying to find champions from within those groups to help further the, you know, the feelings of inclusiveness and have that demonstrated through these pathways of access to all of our services. So that's something that we continue to work on a lot, you know, just being able to know who we're serving and make sure that that's represented on our employee staff, and the trainings and sensitivity trainings and inclusiveness that go with it. So I just wanted to share some of those. We have plenty more examples, but yes, let's take the questions. I'm excited.
Oh, you're muted, Dr. Leon.
Thank you. Thank you, Zara, and thank you, Beatriz. This is
You're still muted.
great. This is excellent. And thank you so much for sharing your experience and your challenges. And we do have a couple of questions here and some comments. We have comments about the recommendations, and all these are great recommendations. Again, if you have any questions, please feel free to type your question in the chat box, or if you would like to ask your question verbally, we can also unmute your line. But there is a question here, and it says, do you have a union and do you use per diem providers?
Well, we do use per diem providers. Beatrice, I don't know what that percentage is. You could provide that. And regarding the unions, no, we are not unionized. Right now, I would say this last 2 years, we've seen a lot of activity in the healthcare sector by, unions promoting that they want to, unionize the healthcare industry here in San Diego and in California in general, which is why we see some of these Senate bills being backed and encouraged by the unions. So we are seeing quite a bit of activity at all of the health centers here in San Diego, union promoting, their programs and why they want healthcare workers to join their union. So that's something else that we're seeing a lot.
And then we have about 30% of our per diem employees. A lot of them, most of them are, because they're getting older or whatnot, they want to slow down. The rest, 70%, they're all our regular employees, 30% per diem. Again, it's just providers that they're just wanting to slow down and, kind of just really slow down and be with their family.
Right, or they could be like specialists, like say those providers that work in our liver clinic.
Yeah.
They work at La Maestra, they do consultations at Stanford University, they work in, the hepatitis B coalitions nationwide. So, I mean, their time is stretched. So we're really blessed and lucky to get them on that per diem basis.
Thank you, Zara. Thank you, Beatrice. Fide, I see a hand raised. Jessica, I'm not sure whether she's trying to ask a question verbally.
Yeah, let me see. Okay.
Hello, can you hear me?
Yes, hi.
Hi, well, I just wanted to come off of mute and just verbally express just how impressed I am with your comprehensive approach to caring for the community. This is just truly phenomenal work that you're doing. And I'm just so glad that you were able to showcase this today. And I do have just one question in regards to all of the strategies that you've put in place. How have you seen these strategies impact your key performance indicators, such as your employee engagement, patient satisfaction, turnover? So I'm just wanting you to connect these strategies to your success measures, if you could speak to that.
Yes, thank you. And
Thank
we
you.
always try to, demonstrate not just to our funders, but to HRSA and our managed care plans in terms of, how does all of this translate into quality and customer service, right? So we've done 2 research studies on what difference does it make to the participants, to the patients, for example, that we have these integrated services, right, and comprehensive services. And what difference does the staffing model that we use make for these patients? And actually the feedback was really something else. It was the staffing was the most important. Yes, it was great that the comprehensive services are there, integrated all in one place, seamless system and all of that. But what really was so made such a significant difference to the participants, the patients and our clients, was that they really, they looked at the staff, they related to the staff because they have so many similarities. And they felt that bond, and they felt like they could go to the staff and ask them for other help or resources because they felt like that communication was open. They trusted them. They were more willing to adhere to treatment plans, even the medication, because they were being told this through people that they trusted, right? And it just really enhanced their satisfaction, the patient satisfaction with the services because of the staff. And then the staff being, we also did surveys with staff, like, why are you here? What calls you to this work? Why do you stay here? It's again, that feeling of belonging. It's not just someplace where you go, you clock in, and it really doesn't matter if it's you or anybody else. You and yourself, your characters, your background, or your character, your personality, your background, the skill sets, and your passion that you bring to the work is what really provides them with that reward and why they want to stay. They feel like they have this belonging, the supportive network at work. It's like a family. That's what many of them described. And they have very long-term relationships. We have a lot of employees that stay with us for many, many years, majority actually. So yeah, I mean, I hope that answers your question. But and in terms of HEDIS, our HEDIS measures have always been very high because of I think because it's the social determinants programs that we've had in place since day one of the clinic, and continuing that effort. And California now has, of course, those CalAIM initiatives, that is the expanded access or expanded care management, ECM, and community services. And La Maestra is the top performer for that. Why? Because you're having to address the patient's, housing issues. Are they on the street? Are they in the car? Is that where their kid continues to have, asthma problems, going to the, emergency room? And nobody basically asked before, I guess, or wherever they went, hey, what's your housing like? Are you in stable housing? And so implementing all of these social determinants in our questions, our history forms, and when we actually record it on our electronic health record. So food scarcity issues, housing, and other issues like the human trafficking. That's that's domestic violence. That all of these challenges that people have. I'm not saying we have the answer to all of them, but at least for the providers to know that there are these issues there that are going to impact whatever treatment plan that patients are set on. So that's what I could offer. Thank you.
Thank you, Zara. And we are a few minutes after the hour. So thank you so much, everyone. Please don't forget to complete the survey. And just a piece of information, there will be another webinar with Dr. Marcellian in the next few weeks. This is regarding collaborations and partnership with colleges and universities to increase or improve your workforce and some of the programs that they have in San Diego. So stay tuned. And once again, thank you so much, Zara. Thank you so much, Beatriz, for this wonderful webinar. And thank you for sharing your challenges and what you are doing to improve the workforce, which is a big challenge for all health centers across the nation. Thank you so much, everyone, for participating in this activity, and see you soon. Have a great afternoon.
Thank you.
Thank you.
Bye-bye.